Welcome. Thanks for joining us with our very special webinar that we have scheduled today by the name of Outsmarting Allergies, a Parent's Guide to Allergy Prevention. We have an amazing expert and special guest, Dr. Alana Jones, pediatric allergy and immunology at Nemours Children's Health. We're very excited to have Dr. Jones with us, and we're going to get started. Today's session, just a couple rules. You can see us, but we cannot see you. You're on mute, but please use the Q&A box to ask any questions that you may have. Share your questions as they arise. We will do our best to address all the questions that you provide us with tonight as time will allow. And this presentation is being recorded and will be emailed to everyone who RSVP'd after tonight's event. So thank you for joining us. My name is Michael Rouse. I'm the Executive Director and co-founder of ESF Summer Camps. And as I mentioned, we have Dr. Alana Jones, who is an expert in allergy and immunology at Nemours. A personal story about Nemours. It is an amazing place where they put children's first. They are outstanding. We have 4 children, a 5-year-old, an 8-year-old, a 10-year-old, and a 12-year-old. And our youngest 5-year-old has spent some time at Nemours over the years with the specialist. And we couldn't feel better than with the experts that are there. So we're really grateful to get to know a lot of the experts, and Dr. Jones is one of them. And I know she has an incredible background, which I'd like to just share with you real quick. She's been working full-time at Nemours in both Wilmington and also in their Deptford satellite offices locations. She completed her pediatric residency at Crozier Chester Medical Center and also her fellowship at Thomas Jefferson University. She grew up in Marlton, New Jersey, in South Jersey, and now living in Wilmington, Delaware with her husband and her 2 sons, who are both 1 and 4 years old. Welcome, Dr. Jones.
Thank you. Thank you so much. I'm happy to be here and talk about one of my favorite things to talk about, which is environmental allergies or allergic rhinitis. So just to explain what we're going to be talking about tonight. So looking at mainly springtime allergies, since that's the season that we're currently in, along with some of the causes for springtime allergies, as well as the treatment options that we use for nasal allergies, or what we call allergic rhinitis. And then also some things that I would recommend that we don't do, or things that are not helpful, as well as when is it a good idea to take your child to see an allergist for their allergic rhinitis symptoms. Also how to avoid some of your springtime allergens. And one secret slide that I put in there that is not about springtime allergies, that I just can't help myself but talk about. And then lastly, some associated conditions that you would be on the lookout for in somebody who's experiencing seasonal allergies or springtime allergic rhinitis, such as allergic asthma or eczema. So pollen, this is the thing. This is the thing that we're all feeling right now if you have allergic rhinitis. Tree pollen specifically is what is in bloom right now, and pollen itself is the way that plants reproduce. So they have a pollination season that is different depending on where you are in the country or in the world. Right now, tree pollen season has begun, and tree pollen itself is the male reproductive cell of the tree that is blowing into the air, and we are all breathing in during the day and the night. The trees that cause tree pollen allergies, however, are a specific type of tree. They're called wind pollinated trees. The other type is insect pollinated trees. So usually those are the very beautiful trees that have a lot of flowers on them. They often smell really good, and those are the ones that have insects that are picking up the pollen, such as bees, picking up the pollen and transferring the pollen that way to help the tree reproduce. But these pollens that are causing nasal allergy symptoms are wind pollinated trees. And the pollen is so small, you generally can't even see it with the naked eye. And while you might be able to see some pollen, like kind of laying on your car in that heavy pollination time, usually that is actually the like pine tree pollen or some of the other larger pollens that are not very allergenic because of their size. The tree pollen that's usually so bothersome is the ones that you can't see. They're microscopic. The picture I have here is a picture of various pollens underneath a microscope. So they're very small in size. Some signs and symptoms of allergic rhinitis would be sneezing, and usually it's repetitive. 4 or 5 sneezes in a row. It's kind of like predictable with how many sneezes you're going to have. Nasal rubbing and an itchy nose is very characteristic of allergic rhinitis rather than non-allergic rhinitis, like somebody who's having a stuffy nose from something like a cold or what they call non-allergic rhinitis, which is a different entity. But if you are always rubbing at your nose as if it's itchy, and kids will do this, not wiping their nose, but rubbing at it, that can be very characteristic of environmental allergies. Of course, a runny nose is associated with springtime allergies, particularly clear nasal drainage. A stuffy nose, being able to only breathe through your mouth because you're so stuffed up can also be a sign. And then I also see people who are very fatigued. Allergies are exhausting on the body, so you will feel more tired if you're suffering. Itchy inside of your ears when you're outdoors. Even in like the roof of your mouth or the back of your throat can be a sign of allergic rhinitis. And, this is a pretty common problem. Up to 40% of the country is suffering from allergic rhinitis from some sort of allergen. And then me as a physician, when I'm seeing somebody who has allergic rhinitis, I'm looking for a few things. And as a parent, you can also look for these particular things in both yourself and your child. But somebody who is chronically mouth breathing, so they're always breathing with their mouth open during the daytime. They're having a hard time eating or drinking a cup because they need to stop and catch their breath. That can be a sign of allergies. And that doesn't mean it's always allergies. There's certainly many other reasons for that, but that's something we look for. Also, nasal ringing, which is like the bewitched thing. That's probably too old of a reference, but when she used to wiggle her nose like that, people with allergies do that all the time. It's just a way to rub or itch your nose without putting your hand on it. It's called nasal ringing. And the nasal crease, which is a small line that goes right over the bridge of your nose, and that's from constantly rubbing your nose around, and you create a physical crease there. Often it becomes more prominent in the summertime when the rest of your body tans, and that little crease does not tan. And usually that's something I see in older kids or adults because it's been so long. Denny Morgan lines are something that you could see underneath people's eyes. So not necessarily the darkness, which is the next point there, allergic shiners, but lines that are underneath the eyes. Those are called Denny Morgan lines, similar to the nasal crease, but kind of on your eyes. And then those allergic shiners, which is when your eyes look very dark or purpley underneath. And you can have that from, again, multiple causes of congestion, but allergic rhinitis is certainly one of them. The clear runny nose you can see, and you will hear the repetitive sneezing.
Dr. Jones, what about
Yes.
trying to, when you see some of those symptoms, trying to diagnose like the difference between this is a cold or a summer cold, or a spring cold versus these are allergies actually?
Yeah, always hard because there are certainly some viruses that can give you a lot of these same symptoms, such as sneezing or runny nose. But, classically, the color of the discharge, usually allergies is more clear, more thin, whereas infection is thicker or can be discolored. The onset of the symptoms, so if this is a chronic issue, has been going on for several weeks, that would be unlikely to be like a viral upper respiratory infection, but certainly could be, like a sinus infection, something like that. And then I wouldn't expect any of these like chronic problems like the nasal crease or the Denny Morgan's lines to be from an illness because they are chronic problems.
Thank you.
Sure. And then just thought of another thing. Fever is never allergies. I would like to point that out. If you have a true fever, 100.4 in the little kids, 101 in the big kids or higher, that is never allergies. That's always illness.
Okay, good to know.
And then signs of allergic conjunctivitis. This is like just about to hit in this part of the country. And this is when your eyes are very itchy and puffy and watery. They get red. It is almost always both eyes for allergic conjunctivitis, and tree pollen, more than other pollens, tend to give you allergic conjunctivitis symptoms. And so that's something that I would expect people to have in like April and May if they're having tree pollen allergies. But again, there are other things, particularly pet dander, like cat dander, that can give you allergic conjunctivitis. But if you're somebody who has just started in April with these itchy eyes, both eyes look red and puffy, drainage, that can certainly be from tree pollen allergies. And to kind of your point, Michael, is this a viral conjunctivitis, like an infection, or is this allergy? Itchy. If it's itchy, that's very likely to be allergy. And if you have to ask your child or yourself, like, do I feel itchy? Is my child rubbing? It's probably not itchy, because kids will rub and rub and rub nonstop because it is very itchy, and it's hard for them not to rub and scratch when they get that way. Right, and then we don't need to go into detail about this, but just how allergies occur. So when you breathe in allergens such as pollen, your immune system is going to pick that up, take it inside, and create antibodies against it. And so your body is thinking that this foreign invader is causing you harm, when really it's just a little tree pollen. But by doing that, this sets off an inflammatory cascade in your immune system to cause all of the symptoms that you would expect from allergies, such as the sneezing and the itching and the nasal congestion. And some people have a late phase response, which is when not only do you have those symptoms as soon as you're exposed, but hours later, you have this nasal congestion that persists. And that's not for everybody, but you may see that after a day of allergies outside, you finally think it's over, but now you're so stuffy for the next 24 hours generally. So some ways that we would consider diagnosing allergies. Of course, history for a physician is always the most helpful tool. Your information as a caregiver is very helpful. But ultimately, to make an accurate diagnosis, you can do an allergy test. And skin prick testing would be the most accurate way to diagnose environmental allergies. And we do this in the office. This is like what they consider a same-day procedure that doesn't require any sedation. It is no needles. There is no bleeding. It is a small piece of plastic, which I showed on the graphic here. This is the exact type of pricker that we use. So it's really like a teeny tiny fork with a sharp end. It is a small scratch underneath the skin, but as I said, there's no needles, there's no bleeding. I'll tell you, the best kids on it, the babies do great. There's no fear about it. There is no pain associated. They do great with skin testing. As you get older, you start to have more anxiety about the test and fear. However, from a pain perspective, it is truly not a painful experience. If you have positive testing, what you'll see is where we scratched you, you will have a hive, or what we call a wheal, and that would indicate that your body is creating a local allergic reaction. And so this can be done with all environmental allergies, such as cat dander, dog dander, tree pollen, grass pollen, and we can separate all of the various trees that are pollinating that could cause allergies to help you diagnose those allergy causes. The other option would be to do a blood test. and that is called a immunocap. The old version is a RAST test, if anybody has heard that term. And really what you're measuring there is antibody levels. So as I was saying before, allergies come from your own immune system creating antibodies against something. So this blood test is a way to measure those antibodies. And this is just another way to check for environmental allergies. It is considered more invasive because it is a needle. You're drawing blood from the patient, so it's not the preferred test, but it certainly can be done. As far as who should get this test, it could really be for anybody who's experiencing environmental allergies, but we, especially at Nemours as pediatric physicians, we do try to limit testing to whatever is only necessary. We try to never do, of course, unnecessary medical testing on children. So for example, kids under the age of 3 rarely have outdoor pollen allergies because it does take your immune system a certain amount of time to become exposed and then create antibodies against the allergen. So it would be uncommon for us to ever do outdoor pollen testing on a baby. Certainly, the closer you get to 3, with the correct history, we could consider doing that testing. And as I stated, we would do this test in the office. We do require that people stop their antihistamines because that could interfere with the test. And for some patients, that's very difficult to do for a few days. And the test only takes about 20 minutes. You get answers right away. And now that you've identified what you're allergic to, avoidance is really the best way to help treat and manage your allergy symptoms. But of course, if you have pollen allergies, that's really not an option for the most part, because we're all living and breathing. Even if you were to keep yourself inside, the pollen's, coming into your home. Because of its size, it just happens to get into your house through your air ducts, through your windows, on your clothes and your hair and your shoes. So you do the best you can with avoidance. However, medication is usually recommended if your symptoms are significant enough. And so I'm going to go through some of the medication options that we have for environmental allergies. So if you are somebody who has moderate to severe allergic rhinitis, which would be considered allergy symptoms more days than not, or symptoms that are bothersome enough that you can't participate in your regular activities because you're so bothered, your child cannot stay in school, cannot focus in school, cannot sleep well, cannot play their favorite sport because of their allergies, then they probably have moderate to severe allergic rhinitis. And the best treatment for those patients is an intranasal steroid or a nose spray. These used to be prescription, but they're pretty much all over the counter now with only a few exceptions. Nasal steroids work very well, and if you want them to work their best, it would be a good idea to start them about 2 weeks before your pollen season has started. And that is where the testing really comes in handy, because if you know exactly what you're allergic to, you can really time your medications well in order to optimize your therapy. So as I said, intranasal steroids work really well and would really be the only medication that you may need for your moderate to severe allergic rhinitis. If you just have mild symptoms, or what they call mild seasonal allergic rhinitis, you can just start with an over-the-counter oral antihistamine, which I think people are familiar with as, Zyrtec or Benadryl or Claritin, and that would be a good starting point for patients who just have mild symptoms. And you can also add it on if you're having those moderate to severe symptoms, and the nose spray isn't all that you need for relief. You can then add on an antihistamine. And then I'll talk more about antihistamines in a couple slides. The next slide is just showing, the safety and the absorption of these nose sprays. So of course, nobody likes the idea of using steroids long-term or chronically in patients. However, these nasal steroids are locally acting and they're microgram dosing. So for example, if you need to go on oral steroids for an asthma flare, you're usually going to get milligram dosing, which is thousands of times stronger than a microgram dose, and it's going into your bloodstream throughout your body. These nasal sprays go right into your nose, and very little of it gets absorbed into your bloodstream. And this table is showing you mometasone, for example, which is Nasonex. The amount of medicine that gets absorbed into your body is only 0.4% of the 200 microgram dose. So very few systemic full body side effects from these types of medications. They generally do not cause any issues with weight gain, behavior, mood, appetite, anything like that. The most common side effects are local to the nose, irritation, or nosebleeds, which can be avoided by proper use. And I do want to go over the proper way to use a nose spray. Because it is important to make sure that your child not only avoids these side effects, but does not experience discomfort or distaste from the medicine that would make it hard for them to take it. So the real best perfect way, if you have a cooperative patient, would be to blow your nose, put your chin onto your chest, shake your bottle up, close the side you're not going to go in, put the nose spray in a little bit, and then tilt out towards your ear. And the reason that you do that is because if you go straight up, it tends to drip down the back of your throat, and that can be irritating. And if you spray inward, your blood vessels are in the septum or the middle of your nose, and that can cause nosebleeds. So we don't want to do that. So we'll spray one spray out towards the ear, followed by the other side, and then try not to blow your nose or sneeze as much as you can for the next 15 minutes, and just dab. And that's the proper way to use nose spray. Okay, and then other treatment options, what else is out there? So there is then add-on therapy. So if you've already done the typical things that we spoke about and your symptoms are not improved, you can then add on antihistamines. And antihistamines, as we said, come in oral versions like the Zyrtec or the Claritin, but there's also nasal antihistamines that are available. And just like the nasal steroid, by using it locally in the nose, there does tend to be less side effects with that if you can tolerate a nose spray. And this all depends on your child and their age, and their tolerance for medications. So nasal antihistamines, they work just as fast, if not a little faster than an oral antihistamine does. And in terms of how effective is it, how well does it work, the same as the oral antihistamines. And whenever I recommend an oral antihistamine, we are always going to recommend a second generation, or what they call a non-sedating antihistamine. So Benadryl, which is diphenhydramine, is the generic. Benadryl is an old antihistamine. It's been around for a long time. However, it crosses the blood-brain barrier and can cause side effects, especially if you're susceptible. So, for example, fatigue would be one of the most common things. It can cause confusion. It can cause urinary retention in the elderly population. It can even lower your threshold to have seizures if you're somebody who has epilepsy. And it only lasts for about 4 to 6 hours. So it's usually not the best treatment for environmental allergies, when the alternative is this non-sedating antihistamine or second generation antihistamine, which works just as well, kicks in just as quickly, and lasts for 24 hours, rather than that 4 to 6 hours. So we prefer those antihistamines over the Benadryl.
Doctor,
And then,
we've
yes.
got a couple questions relating to this, and it was really based upon, is there any preventative um, nasal sprays that you would recommend over the counter that could mitigate the chances of having, those allergies over the course of the spring and summer?
Yes, well, definitely the nasal steroids like Flonase, as I said, really are all over the counter now. And if you do use it about 2 weeks ahead of time, you are sort of preventing those allergy symptoms from happening. And we know that they work best in that manner. If you wait until your symptoms have already started, it's difficult to make sure that the medication is preventative and helpful because you've already had the inflammation occurring in your nose. So yes, I would say from a preventative standpoint, the nasal steroids are a good idea. Also, over-the-counter nasal saline is always going to be recommended. Do I think it's going to work as well for somebody who has moderate to severe allergic rhinitis? No, I don't. But I do think it's a great add-on medication. It's certainly nice to help flush out any allergens. It's very hard to overdo nasal saline or to hurt yourself with that. We do know that using nasal saline before a prescription nose spray makes the prescription nose spray or an over-the-counter, sorry, intranasal steroid, I should clarify. A medicated nose spray, using saline before that medicated nose spray can make it work better in patients. So I would say that those are probably your best options. Now, there are nasal decongestants, nasal spray decongestants such as Afrin. Afrin is available over the counter, but it is not a good long-term solution for environmental allergies. And actually, if you look at the back of the box, it's not meant to be used for more than 3 days in a row. And the reason is that you can have what's called rebound congestion from this particular nose spray, because it is changing the blood vessels in your nose. And so your blood vessels kind of have this like little addiction to the nose spray, and it becomes a real problem. But for short term, 1 to 3 days, you can use like a nasal Afrin, especially before your intranasal steroid. No longer than 3 days. I've seen people addicted to it in a dangerous way. I hope that answers the question.
It does. Thank you. A number of people are commenting right now, so appreciate that. And
Okay.
they actually asked the Afrin question as soon as you, and right when you started talking about it, and then they just commented how grateful they are for your answer.
Yeah, absolutely. It's not funny, but it's a little funny how addicting Afrin can be, because it really feels so great for somebody who is really congested,
Yeah.
and it's very hard to get them off of it. I mean, there are people who have been on it for years, and it really destroys your nose. It's
Wow.
a dangerous thing.
Well, but from what you're saying, the Flonase, which is over the counter, but it is a steroid. It is okay to do it 2 weeks prior to, that heavy allergy season, regardless of age.
Yes, that is the best way to use it. I always recommend to my tree pollen allergic patients that they start their intranasal steroid on Valentine's Day. We use that as a marker because that's about 2 weeks before the pollen season is going to start. And so Valentine's Day, you and your nose spray back together, started regularly, because it is one of those medications that works best when you take it on a daily basis. Doesn't work as well for as needed use, as opposed to the antihistamines, which work great as needed. However, not usually enough if you have that moderate to severe symptom.
Yep. Thank you.
Yeah, you're welcome. And then the last thing on the treatment options that I wanted to mention is what they call a leukotriene modifier, or Montelukast, which is the brand name for Singulair is the brand name for Montelukast. Singulair is a prescription medication. It's not an antihistamine. It's not a steroid. It's its own type of medication. So leukotrienes are another chemical that gets released by your immune system during allergic reactions, just like histamine is. Histamine gets released, so do leukotrienes. So this particular medication is helpful to block the leukotrienes from causing all of the inflammation. However, it has recently gained a black box warning by the FDA, and that came out a couple years ago, and it's specifically for mood issues, depression, feelings of hurting oneself, like what they call suicidal ideations, vivid nightmares, or sleep issues. And of course, not everybody who takes this medication experiences those side effects, but because of the severity of those side effects, especially in a vulnerable population like the pediatric population, it is no longer considered the first line treatment for allergies. It's really considered add-on therapy. Only for a certain population, and absolutely you would want to have that conversation with your doctor about whether those side effects or something that your child or you yourself need to worry about or be on the lookout for. Now, once you stop the medication, those side effects do go away. So no like long-term damage there, but obviously something to think about. And then oral decongestants. So oral decongestants, which is like Sudafed. Sudafed is over the counter, but it's behind the counter. So you don't need a prescription, but you have to go up to the pharmacist because people have used it inappropriately to make drugs. So if you get the one that is behind the counter, but without a prescription, which is really like Sudafed or pseudoephedrine, that does work very well for congestion, but does have some side effects in those vulnerable populations. So in young children under the age of 4, you would want to be cautious and probably not want to be using those. People who are in their first trimester of pregnancy, somebody who is breastfeeding, somebody who has cardiac arrhythmias, hypertension, glaucoma, multiple things. So if you're somebody who is a teenager or an adult with no significant medical issues, this could certainly be an option for you. But if you do have underlying medical conditions, I would be speaking with your doctor first about using this. And not only does Sudafed come by itself, but Sudafed is available with antihistamines, those combination medications that are over the counter, Zyrtec D, Allegra D. So those things can be helpful. They're not the best tool, but they do help if you need relief from congestion and you're not getting it from the other ways, or perhaps you're not able to tolerate some of the other ways that we talked about. There is phenylephrine, which is available over the counter. That's the decongestant that's like being pulled off the market. If anybody has seen that in the news recently, it's in most cold medications and it's like as good as water. It really doesn't work. So for that reason, I wouldn't recommend getting anything with phenylephrine, and it may not even be available in the future. And then I want to mention some prescription options, which would be a combination nasal spray. So they have come out with these 2 options, combination nasal sprays, where they have a steroid and an antihistamine in one nose spray. The volume is less, so it's a little bit more gentle on your nose than using like 2 nose sprays twice a day. You just use this one nose spray. And there's, like I said, there's 2 different ones. They're prescription only, and those are good for people who have the moderate to severe nasal symptoms or had some sort of a problem with one of the other nasal sprays that we talked about. And then lastly, for prescription medications are oral steroids. This would be like prednisone or Decadron. And this is just like, do not recommend, would avoid. This is the dangerous stuff. This is like stuff we did 100 years ago when there was nothing else. And so while prednisone or steroids work really well, the side effect profile is much higher than all of the other treatments that I have talked about. Even one burst, as they call it, one 5-day course of oral steroids has been associated with adverse reactions and associated complications like pneumonia, bone issues, ulcerations in your GI tract. So certainly not the preferred option. And then some non-medication options. Nasal saline, as we talked about, and even better, if you could, is nasal irrigation or a sinus rinse. They sell these in a variety of ways, but really one of those like neti pot, Neomed things is a way to flush your sinuses using no medication, although you could use medication if your doctor prescribes it. But you want to use distilled or boiled water for this, not tap water, not even if you have a filter on your tap water. And that's just for safety reasons because you're putting this water sort of like all throughout your sinus cavity where you could potentially like have an infection issue. It is extremely uncommon for that to happen, but there have been a few cases reported when they've used tap water. So distilled water is easy enough to buy in the store, or you can boil it and like let it cool, obviously. And you could use that once or twice a day. Ideally, you would use that before your prescription or over-the-counter nasal steroid. to really maximize that benefit. And it's going to work the best over the first like 4 weeks or so. So it may not be an immediate relief, but it might be the kind of thing that you want to use on the regular for about a month or two during your pollination season. And then there are other options that are available over the counter. So intranasal cellulose is sold over the counter. You can find it in some like Sprouts, like those kind of health food stores. You can find it on the internet. And there is some data that this can be helpful. It acts as a barrier on your nasal mucosa to prevent the allergen from getting into your nose. So one way to use it is to use it right before you go outside or you're exposed to your allergen. Another way to use it is to use your um, intranasal steroid or your prescription nose spray and then put the intranasal cellulose in to like keep it in there. So there is data supporting both of those options. So that's something that you could consider using. And then as far as hit or miss, homeopathic or naturopathic type of options, there are a lot of different uh, um, herbal remedies, but unfortunately, there's no significant data on those things. There's limited data on curcumin, which is the active ingredient in turmeric. Taking that orally on a regular basis has some data, nothing very powerful. And then there are nasal administration of cinnamon extract, has limited data. That would make me sneeze. Acupuncture, probiotics, these are all things that are not proven, likely not dangerous, but certainly not proven to be helpful. I would also, just as a warning, remind some people that a lot of these like naturopathic or homeopathic medications don't go through any validated screening process the way that the FDA needs to see like data and evidence-based medicine and research behind the medications that are approved. Vitamins and herbs don't need to go through that same screening process. And there have been, even in this century, there have been medications, like herbs, excuse me, that have been pulled off the shelf for having dangerous ingredients in them. So just be cautious about what you are looking at. And then I can't have a talk on allergic rhinitis without talking about local honey. So this unfortunately is a myth, but local honey has been touted as a way to naturally cure your allergies. But as we already talked about, the types of tree pollen and grass pollen and weed pollen allergies that we have, we allergy sufferers have, are wind pollinated plants. Honey is made by bees, and the bees are picking up the honey from flowers, and they are coming off of insect pollinated plants, which is not causing you or your child's pollen allergies. So unfortunately, local honey does not help with environmental allergies because it's just not the right pollen that you're exposing yourself to. And then allergy immunotherapy or allergy shots. SCIT stands for subcutaneous immunotherapy. And so I'll talk a little bit more about allergy shots. This is a very old school treatment. It's been around for over 100 years. It's been saying that for 20 years, so now it's been around for over 120 years. It's very effective. It's 80% effective in about 80% of patients. And that's at least if you are going through a board certified allergist, that is the statistic. And in the long run, while it is costly, it is more cost effective than using these medications that we spoke about for the long run, because what you're doing is you're desensitizing your immune system so that you're no longer allergic to the things that you're currently allergic to, or at least you have very minimal allergy symptoms in response to them. And this can offer protection to indoor and outdoor allergies, pet dander, dust mite, cockroaches, molds, horses, pollens. It's also the only treatment that we have that helps pollen food allergy syndrome. And pollen food allergy syndrome is people who have an itchy mouth, itchy gums, itchy roof of their mouth when they eat fresh or raw fruits and vegetables. And this comes from pollen allergies. So if you know anybody who is like a teenager or up maybe even a little younger, who says that they're allergic to a fruit or a vegetable, almost always, not always, but almost always, it's pollen food allergy syndrome. And it's because they have pollen allergies. Their immune system thinks that they're eating the pollen that they're allergic to when they're really just trying to eat a fruit or a vegetable. However, this protein that's in the fruit or vegetable is very heat labile, they call it. So when it hits your belly, all the acid in your stomach, the heat in your stomach breaks it down, does not cause an anaphylactic reaction. It's just that mild local irritation. And allergy shots, because you're curing the root cause, which is your pollen allergies, can fix your pollen food allergy syndrome.
Doctor, a question that came up
Yes.
was in terms of these particular immunotherapy alternatives, and I know it's been well studied for over 100 years. One of the questions from our families stated, is this the same type of shot year after year, or is there a new type of form? I think lots of people are worried about these new types of viruses and things and what's in these shots. And so the parents basically asking is this a new shot that is kind of re-emerging every year or updated every year, or is it the same one that's been done for 100 years that works?
Yeah, that is such a great question. So I feel like I need to explain a little bit better about what allergy shots are and how they're made. So they are made individually. So for example, Michael, if you brought in your 8-year-old to me and we did their allergy test, we would then look at their results, see what your child is allergic to, and base on those results, make allergy shots specifically for your son for his allergens. So if he's only allergic to cat, dog, and tree pollen, he's going to get cat into a little vial, dog allergen into a vial, and tree pollen into a pile. And these vial, excuse me. These are the allergens themselves. They're not medication. There's no medicine in here. They're just allergens in here that are standardized, produced by a company, collected naturally, cleaned and produced by a company, and then given to allergy offices. And we would use those to add into this little vial that we would then dilute. So we would take that vial, add, pull a little bit out, add sterile water to it, and we do that 5 times. So the very first dose of your allergy shot is only 1 to 10,000 in terms of the concentration. So it's just a little teeny tiny bit of your specific allergen with no medication and a lot of sterile water. And your child would come in, Michael, and he would get a very small amount, like 0.1 mLs of that allergen injected underneath his skin, not in the muscle, just under the skin, and then come back the next week for a slightly higher dose, 0.2 mLs. And you build up that dose. You're building up the tolerance in an extremely careful and calculated way. And by the time you have done that, over about 6 months, you will reach your maximum dose, and it doesn't get any stronger from there. Once you've hit your maximum dose, or what they call your maintenance dose, you go to once a month for about 3 to 5 years. So this is a big time commitment, lots of visits to the doctor. We only give them under supervision because, as you can imagine, if you're giving something you're allergic to, you could have a risk of having an allergic reaction. Now, statistically speaking, the chance of that happening is less than 1%, but it is possible. And we have a lot of precautions in place to make sure that that doesn't happen. That's the reason for the long weekly buildup, to make sure that we do it safely. But that is how allergy shots are made. So they're made individually. The process has changed over the years in the way that we collect the allergen. It is a lot more humane from the animal side of things, and it is a lot more sterile in the pollen way. But to answer your question, it is nothing like a vaccination, where we're using any type of like germ or virus or medication for the allergy shots.
Very interesting. And does this pertain also to food allergies, where if somebody had a tree nut
Such a
or
good
a peanut,
question.
and would they be able to do such a process as well?
Such a great question. No, unfortunately, this does not work for food allergies. They have looked at this for food allergies back in like the 90s. It was causing severe allergic reactions. It was too dangerous. So we have not been successful in desensitizing to food allergies in this manner. There are other ways that we're treating food allergies now, and there's also a biologic injection called Xolair, which is a medication that has just been approved for food allergies as of a year ago, but totally different concept and mechanism than allergy shots.
Great, thank you.
Yeah, you're so welcome. And so we do allergy shots. This has ages 5 and up. Never met a 5-year-old that was able to really do it well. Did have one medically complex child who was very used to needles at the age of 6, and they did a great job. But typically I start around 7. Totally depends on your child, though. I have 18-year-olds that are not ready. So I'm almost 40 and I'm not ready. So it's not for everybody. And then, as I said, it can be time consuming because they are weekly injections. We watch you for 30 minutes. Even if you're a doctor or a nurse, we're not going to let you give these things at home because, of course, we want to make sure that your child is like very safe. Okay, and then avoidance measures. So as I said, of course, you can't avoid all the pollen in the world, but some things that you can try to do is use your air conditioning whenever possible. Do not keep your windows open whenever possible, and you would want to have a HEPA filter in your air conditioner if you have central air. So HEPA filters really filter down the allergens that are coming through your home down to like 0.3 microns, very teeny tiny. Most pollens like tree pollen or grass pollen, for example, is around 30 microns. Cat dander is like 5 microns. So a HEPA filter should filter most of those things well. But this is a constant flow of pollen into your home during the pollination season. Tracking pollen counts can be helpful. So we know that the pollen counts are the highest in the mid-morning, like between the hours of 5 and 10 a.m. So if you have the option of not going outside at that time, maybe don't go outside at that time. Pollen is counted by allergists. And usually there's one person who does it for a specific area. The person who just does it for our area for the last 30 years has now retired. And they don't have a human counter for the first time in decades. So we're going to be relying on a new machine to count the pollen for us. And I hope it can be as accurate as our human pollen counter was. But you could track the pollen counts on like your phone, on the apps, the weather app. Zyrtec has an app, so it's easy to track that. Other things would be watching when you come inside. So if your child is outdoors playing, at the bare minimum, have them splash their face with water and wash their hands. If they can't get a shower, I understand that, but just try to do those bare minimum things. And then replacing your car filter, not something you might think of, but like keeping your air conditioning on the car and replacing the car filter every couple of years. When they're outdoors, especially in that April, May time, trying to wear a hat with a brim on it, and the sunglasses can keep the pollen out of your eyes and off your face a little bit. And then lastly, when you come home, take your shoes off actually, because you do track pollen, you're stamping on it, all day, and then you're bringing it into the home. So try to take your shoes off. And then this was my like secret slide that I slipped in, even though we're not talking about pet allergies. I just want to say one thing, and I don't want to start any fights, but there are no hypoallergenic cats or dogs. And I know that they market them that way and they sell them for a lot of money and they're so cute, but they are no less allergenic than any other cat or dog. Doesn't matter if they have fur or hair or no fur or no hair. The dander or the allergen is in their saliva, their skin, their urine. And I'm telling you this now because it breaks my heart when I have to tell people that in the office when they already spent $5,000 and are in love with their dog. So that's my only thing. I don't want to talk about animals anymore. And then just very briefly, I just wanted to touch on allergic asthma because it is so common. 40% of people who have allergic rhinitis have asthma. 80% of asthmatics have allergic rhinitis. So they really can go hand in hand. And keeping good allergy control is very important for keeping good asthma control. So if your child does have asthma, it's really important to stay on top of their nasal allergies, even if they're not having too many symptoms, because there is this like one unified airway hypothesis where your nose is connected to your lungs. So keeping that inflammation controlled from the top all the way down to the bottom can be really helpful. This graphic is a little graphic with the mucus that's coming out, but it just shows you the airway of an asthmatic, how the walls look very thick, so there's less room for the air to come in and out of. You have all this extra mucus being produced. So not only does your child maybe exhibit like runny nose when they're having allergy symptoms, but they, as an asthmatic, are producing a lot of extra mucus in their lungs. So just like full of mucus, really hard for them to get all that stuff out when your airways are narrowed. And you would, and sorry for this picture, all people who use inhalers should use spacers. This is not an allergy approved graphic. So asthma is a chronic lung disease where you would expect symptoms like coughing, wheezing, trouble breathing, usually related to specific events such as allergens or illness or exercise. And that's different for everybody. So just because your child is very good at soccer and running doesn't mean that they couldn't have asthma. Did you have a question, Michael? I saw you unmuted.
Spacers.
Oh,
What do you
yes.
mean by spacers?
Actually, I'm going to have one slide, if you don't mind. I can go over them in detail because I think they're so important. This is just a graphic of normal airway versus an asthmatic airway and one during an attack. You could see how tight it gets and what's really hard for those kids to breathe. And then on the back side of the airway, you see the muscles squeezing it as a cause of an asthma attack. I think this is my spacer slide coming up next. Nope, not yet. So I think I'm running out of time, but this is albuterol, which is an airway opener. So this works very quickly within 15 minutes to open your child's airway and allow them to breathe. But long term, this is not a solution to the underlying inflammation. This is a temporary relief. And then if you are using a spacer, this is kind of the way to do it. So you would want to open up your medicine, prime it, which means the very first time you puff it into the air. So that's something to look at, your child's inhaler. Make sure you check the insert for that, whether or not that's necessary. Also, if you haven't used your inhaler in a long time, if it's been a few months, you might have to prime it again, check the insert. So you take the cap off, you put it into the spacer after you've shaken it, and then your child puts their mouth around the spacer, breathes out to exhale all the air from their lungs, puff the inhaler, and a slow, deep breath in and hold for 10 seconds. And the spacer is a chamber that connects from your inhaler to your mouth to allow the medication to get deposited into your lungs instead of the back of your throat. And so all people who use inhalers should have a spacer with them if it's a pump, a puffer, and not a breath activated medication. And the reason is that it just deposits it better in your lungs. It has nothing to do with the way that your child or you can use your inhaler. It's really to make the medicine work better. And if your child can't hold their breath for 10 seconds, either because they're having an asthma attack or because they're too young, then you can get one with a mask on it. And all your child has to do is breathe in and out for 6 good breaths, and the medication will get in. Even if they're crying, 6 good breaths and the medication will get where it needs to go. And then again, steroids are inhaled corticosteroids. This is like your daily inhaler. This is to keep the inflammation down. So it doesn't help right away when you want to open the airways. That's like your rescue that we talked about. This is your everyday preventative medicine. And if you're thinking, well, like this sounds a lot like the nasal steroid that we're using for the nose, that's because it is. We're looking at very similar things. What's happening up to your nose is very similar to what's happening into your airways. So it's sort of the same treatment plan. So using this daily targeted steroid that's just going into your lungs will help reduce the number of flares that your child has and is overall a much safer option than oral steroids. And then this is just if you really wanted to nerd out with me on the math and say, well, are steroids healthy every day? This is breaking down the math of taking what they call a middle dose of the fluticasone, or used to be called Flovent inhaler. So this would be like considered a slightly higher than typical dose of an inhaler. So if you're using it 2 puffs twice a day, which is the typical prescription, 365 days a year, you compare that prednisone is 8 times stronger than fluticasone, you're only giving your child less than 20 milligrams of steroid that's going right into their lungs, not their bloodstream like an oral steroid. And again, a typical dose of prednisone for like an asthma flare, anywhere between like 20 and 60 milligrams a day for 5 days. So significantly less steroid by using this preventative medication as prescribed by your doctor.
Dr. Jones, is Flonase in that category?
Flonase would be an intranasal steroid. The dose of Flonase is 50 micrograms, and it's 1 puff once a day for children.
Okay,
So less than that.
great. Thank you.
Yeah, you're welcome. Okay, and this, I actually kind of already mentioned this, but just really stressing the importance of keeping good allergy control when you have somebody who has allergic asthma. And it's just a reminder that if your child does have persistent asthma, it's actually in the guidelines, the treatment guidelines that all doctors follow for asthma, that they be evaluated by an allergist to make sure that they don't have environmental allergies, because it is such a key part of controlling your child's asthma. All right, and then I had to throw this in for upcoming summer. Sunscreen recommendations for kids who have eczema or sensitive skin. These are usually my go-to ones. So unfortunately, they're never the easiest ones to rub in, but they do contain the least amount of harmful or sensitizing chemicals. Sensitizing just meaning things that can cause like allergic reactions, contact dermatitis. These ones are my go-tos.
I was told by a doctor, always look for the word mineral on the ingredients.
Yes.
Is that a good word to look for?
Yes, yes, I would agree. And if it's hard to rub in, you're doing it right.
All right, great. Doctor, this is great. I know we have several questions. If you have a couple minutes, we'd love to just run them by you from our audience. First of all, thank you for
Sure.
the presentation. This has been really eye-opening. One question came from a parent that wanted to better understand your Valentine's Day kind of kind of get ready moment. And when should parents really put on their radar, that allergy season, that they should start the preventative approach, and how long does that last?
Yeah, great question. So if your child is allergic to tree pollen, if that is the cause of their springtime allergies, then the Valentine's Day is a good marker, because tree pollen will start in March, the beginning of March. Sometimes it's as early as the end of February. And while it peaks, meaning like it's the worst in April, and the beginning of May, it has started in March. So by starting your medication 2 weeks earlier, you are priming your nose to be hit with that pollen. You're decreasing the inflammatory allergy mediators that are in your nose, and you're already getting yourself ready so that once the pollen season hits, you're not going to experience the significant symptoms that you maybe previously had. And as far as how long it's going to last, if your child or you are just allergic to tree pollen, that will be gone by usually the beginning of June. And so I usually will say, like, well, until about school is out, you would want to use your medications. Now, grass pollen is starting in May. So if you also have grass pollen, that's going to go through July. And then you would probably want to use your medications until like the beginning of August. But then you might be allergic to ragweed, and that starts in August. So it all depends on what you're allergic to in terms of how long.
We have another parent who says, I have given my child Flonase every day for the past year. Is that bad?
Not at all. You're doing a great job. The only thing I would say is If you're using a nose spray like that every day, then just make sure that your child sees their doctor, whether it's an allergist or your pediatrician, about once a year to make sure the very rare complications from a nose spray are being monitored for. And when I talk about the rare things, I'm talking about extremely uncommon problems with growth. So a change in your height velocity, like your child is not growing as tall as fast. It's very uncommon, especially with a low dose nose spray like that. But if you do have an allergic child, they could be on a daily inhaler, they could be on a steroid nose spray, they could be on a steroid cream. So just having, a doctor look at them about once a year is appropriate, but absolutely not. There are many, many patients who need that nose spray all year round.
Great, doctor. Another question came up, and that was when a child is going through their with the routine of allergies, should parents expect some type of change in food intake, in appetite? Is there anything that they should be aware of?
I would not expect any significant change in appetite from just allergies alone, with the exception of patients feeling fatigued during their allergy season and children, if they're too fatigued. I know at least my 4-year-old is a very picky eater, and if he's off in any way, like dinner might just not be happening. So I suppose that's a possibility.
Okay, great, thank you. And one last question. For a first-time parent who has a child who is 3 or under, when is the right time to have your child checked with an allergist to see if there's any potential allergies that they may have?
Good question. So, of course, I'm going to go by the patient's history as the most important tool. So, if this child has maybe a family history of allergies, but has no symptoms at all, has a normal exam, I'm not checking them for allergies, and I wouldn't recommend doing so. But if your child does have symptoms of allergies, I would check for environmental allergies as young as 9 months of age. And typically, the things I'm looking for at that age are indoor allergies, pet dander, dust mite, pests if they're a problem like cockroach or mouse. But the outdoor stuff, I tend to wait until around the age of 2 if necessary. Typically, it's 3 or older.
That's great. Well, Dr. Jones, thank you so much for your presentation, and for our families. You can get all the updates, all the greatest tips from the experts at Nemours at nemours.org. Or that you can go to their website also, which is kidshealth.org, for more information. There's a tremendous amount of information there right at your fingertips that you can get from all the great experts and folks at Nemours. And again, Dr. Jones, thank you very much for your time, and for all these preventative tips as we enter into the allergy season.
You are very welcome. Thank you.
Thanks so much. Have a great night, everybody. Take care.